COVID-19 community updates. And for context, we are recording this on Thursday, August 13th, because we do know that these run periodically over a period of time. So once again, you have myself as mayor and Brian Kays, our emergency manager, for our normal updates. But I'm very pleased to advise that we've got two special guests today that we're very pleased to have joining us, that are going to be providing some very comprehensive and extra information that our community really needs right now about the COVID-19 response that is occurring in our community and in the area. So in a minute, you're going to be hearing from Dr. Amy Frykota, who is the Medical Officer of Health for Prairie Mountain Health right here in our region. And I'm not sure if everyone realizes that while we see Dr. Roussin on the broadcast and he's leading this pandemic response, he's not completely a one-man band. He has other medical officers of health stationed in every region. In fact, Prairie Mountain Health region has two such doctors in our midst, and we're very comforted to know that. And in addition to Dr. Frykota, we have Deanne Baker, who is the primary health care manager at our 7th Street Access Center here in Brandon, who also, her and her team, very instrumental in the pandemic response. So without further ado, I'm going to turn it over to Prairie Mountain Health's Medical Officer of Health, Dr. Amy Frykota, and welcome.
Thank you very much, Mayor Crest. It's an honor to be here today, and thank you for the opportunity to share about COVID. I'd like to start first with sharing about some of the cases that we have currently in Prairie Mountain Health Region and in Brandon, and then to talk about some of the precautions that we are recommending at this time. As many of you have heard in the news the last week, we have had a surge in activity in Prairie Mountain Health Region, with greater than 58% of the cases over the last week have been in our region, greater than 58% of the cases in all of our province. Our current case numbers that I'm going to provide are as of the data for August 12th morning, and we have had some additional cases since then, but the information I'm going to provide right now is up to date for August the 12th morning. In Prairie Mountain, our current cases are 79. Of those cases, there are currently 67 cases linked with the Brandon cluster. This cluster did not have a specific acquisition event, and by that I mean there was not a specific community one-time gathering where these cases were connected to, but rather these cases, they're connected in many ways, and they're connected geographically, living nearby one another, and connected with connections involving frequent contact with one another. All that to say, there was a lot of contact early on between the cases and others from that community, and that's why there was we've seen a significant number related to this cluster. In addition, 26 cases worked at a specific work site or business within our health region, with 23 of the cases currently that are also identified as part of that cluster. So of those 67 cases, 23 of those cases currently are identified with that business. I can say that from the business, there is no evidence of workplace or interfacility transmission. We have been working alongside with workplace health and safety, with agriculture, with resource development, and with CFIA, which is the Canadian Food Inspection Agency. We've been monitoring the situation and all have been working well together and assisting along with that business. And the business has done an excellent job. They have gone beyond what is recommended by public health, with even isolating a large number of workers that were not even recommended to be isolated by public health. They put in numerous protocols to further assist at that site, including having various workers cohorted into groups. Really, we just want to commend that business and to again state that there is no evidence of workplace transmission. Therefore, overall, in Prairie Mountain Health and in the Brandon City, the majority of the cases are linked to the cluster or to close contacts of previously identified cases. Most of the cases, as I'm saying, are linked. If the cases are not linked to another case, that is what we call community transmission or unknown acquisition, and the majority of our cases are linked. The preliminary information does show, though, a small number of cases that we do not know what they are connected to, They have unknown acquisition or again community-based transmission. Overall in our province, the numbers for community transmission is around 11%. So of all the COVID cases, we have around 11% related to community transmission. And in Brandon, despite the recent surge in activity, the community transmission rate is currently close to that number and a bit lower than that. Wanting to say that to encourage yourselves that we are not seeing a significant community transmission with our current surge in numbers, despite the increase in surge in numbers we're seeing. But even though we're not seeing community transmission, we do want to state that the increase in cases is something that we want to be vigilant for and be watching out for. And the increase in cases are a reminder to us that COVID-19 is not done with us here. And that as Manitobans, as those living in Brandon and in the areas in Prairie Mountain Health Region, we want to continue to be prepared for COVID-19 and that it is going to be with us for some time. We need to learn to live with the virus. We need to find ways to continue our lives, but how to do that cautiously. We need to get used to living with COVID cases and hearing that these cases are amongst us, but not continually having to require to shut things down. And with that, then, we need to get used to living with the fundamentals. The fundamentals or precautions have helped us prior. They're the things that have helped us where we are and that kept the numbers low in Manitoba. They've helped us before and they will help us again. And as many have said, we are not helpless. There are things that we can all do, precautions we can take to limit the spread. And with that, I'd like to talk again about some of these fundamentals and encourage everyone to be putting these in place, and if we've slacked off a bit because our numbers have been low in our province, to re-encourage yourselves to please put these fundamentals in your own individual practice. So the basic things, again, stay home if you're unwell. Even if you're only feeling a little unwell, please stay home. That's what you can do to protect both yourself and others. Practice good hand hygiene. Do not share items with others. Practice physical distancing, as you've heard over and over, which is staying 2 meters or 6 feet apart from others that are outside of your home. So practice physical distancing when you're with others that are outside of your household. And I'd like to share that point because with the increase in the gathering size, as we've seen with the different phases, we don't want that to be the assumption that you can be in a gathering size with that group but not be practicing physical distancing. You want to be practicing physical distancing when you're out with others that are outside of your household. If you're not able to physically distance and you're out in a location, then consider either leaving that event and not attending the event at all. And to avoid crowded indoor places. As well, if you are at higher risk of contracting COVID-19 or at higher risk of more severe illness, and these would be someone who is greater than 65 years of age, or someone with other medical conditions, then we want you to also consider to continue to stay home as much as possible and avoid contact with people who are not in your household, and to be more vigilant with these precautions. I'd like to talk a little bit about masks because we've been hearing a lot about masks lately. We have now recommended in Manitoba to use masks in places where one cannot physically distance or where you do not feel confident if you can physically distance in indoor places. As well, we have been having some messaging that if we are seeing increased cases, for example, what is happening in Brandon with the increased surge in cases and in the Prairie Mountain region, then there would be value to consider using a mask. Masks, though, are not They are in addition to the fundamentals that we have here. So they do not replace it. You still want to be doing the good hand hygiene, staying home if you're not well, physical distancing. But in addition, if you don't feel you can physically distance or you're not sure about that, or if there's increased cases you're hearing about, there is value to be considering a mask. At this time, it's not mandated by the province, but as I've just shared, there would be value to be considering it. There may be more of a directive specifically around masks and mask use in our province from Manitoba Health and my colleagues at Manitoba Health, and that could be coming in the fall. But at this time, it's not specifically mandated. And again, the province has been sharing in areas that we see increased activity, such as our surge that we've had here in Prairie Mountain Health Region, even though limited community transmission, there is increased activity, that it's vitally important to follow the precautions and to be vigilant with these. The province going forward may provide some more specific targeted recommendations, such as more specific public health recommendations or restrictions, not for the whole province, but may consider that just for targeted areas. And that's what we've heard on some of the recent news briefings. Some may have heard that with Dr. Roussen's most recent messaging. And all that to say, with what is happening in Prairie Mountain, I do want to assure everyone that Manitoba Health, myself, my colleagues in the province, we have been reviewing the current cases along with a number of other factors. You've heard a lot about positivity rate now. That is being reviewed. Community transmission rates are being reviewed. Other indicators on the health system, such as hospitalizations and other factors. At this time, reviewing all these indicators, we do not feel we need to put a specific targeted recommendation on Prairie Mountain Health or on Brandon, but I wanted to assure yourselves that that is being reviewed. And if at some point the province feels we need targeted recommendations for a specific area in Manitoba, such as our region, then that would be provided. So there's not a change to recommendations currently outside of what is recommended for the province in Manitoba for our area, but that at some point these targeted recommendations could occur. And oh yes, I wanted to finish with sharing that I do want to remind Manitobans to be kind and realize we're all in this together. And stigma has no place in the pandemic plan. Stigma adversely affects public health's ability to manage this. It leads to challenges such as decreasing the likelihood for people to be tested. It decreases the likelihood for people to cooperate, to identify places where they may have attended, or to identify contacts. So we need to be kind to one another and work through this together. And we need to stick to those fundamentals to diminish the spread. And because we have been hearing of more cases here in our region, I encourage everyone to be vigilant with those fundamentals and to really be going back to them and enacting them in their own lives. Before I finish and pass this over to my colleague Deanne, I'd like to briefly talk a bit about testing and to a few points around that. The best timing for testing is 24 hours after symptom onset. We had many cases that were tested a number of days after they were symptomatic. And by the time then we got to the contacts, we work very fast in public health and trying to identify contacts as soon as possible after we identify a case. But because the cases had been tested a number of days after they were symptomatic, by the time we did get to some of the contacts, they were already symptomatic. So I want to share to ensure if we can, we want to identify the contacts early so that they have the opportunity to self-isolate. And therefore, if you can get tested as soon as possible after the symptoms, not too soon, but as soon as after that 24-hour window, if you can try to get tested, that's very, very helpful. And the asymptomatic testing is not recommended, and testing before that 24-hour window is also not recommended because too early can lead to a false negative result. With the testing, just around symptoms, if you experience symptoms, any cold type symptoms, you can please self-isolate as soon as the symptoms develop. No matter, even if they seem mild, please do that and self-isolate. And that means staying at home and avoiding others in your household at that time. And then if you again could seek testing 24 hours after symptoms develop, even if your symptoms are starting to get better. And that is when the test is most effective, as I've said before. Again, if you test before that time, or if you test if you're asymptomatic, the test is less effective, and there is a higher risk of a false negative with that. Early self-isolation and seeking testing about 24 hours after symptoms develop really reduces the risk to close contacts, and it very much helps public health when we're doing our contact tracing. It also is important because it helps reduce community transmission and the chance of community transmission. And then if you do test positive, public health will contact you with further directions. You can make a plan to self-isolate, to stay home and avoid others in your household. If you are unable to do that, there are isolation centers available, and public health will be in contact with yourself to assist with that. And I did want to finish with saying if you do have symptoms or you do develop COVID, you didn't ask to get in COVID and you are not in trouble. We don't want people to feel that way. We want to know that sharing contact tracing information is important. It helps stop the spread of COVID-19, and we appreciate all the help that those who have COVID are providing to public health to protect both yourself and others around you. And I hope that was helpful for everyone. It may have been a bit, I hope it wasn't too fast there, but I really appreciate the opportunity to talk with those in Brandon and others who are outside of Brandon watching this communication. And we just want to commend so much the efforts that everyone in Manitoba has been doing and all of those in the Westman area. It has been greatly appreciated, and we know that we can do a lot to decrease the transmission of COVID-19, and I just really appreciate everything that everyone is trying to do in that regard. With that, I will pass this on to Deanne Baker, my colleague, and she'll be sharing a bit about testing sites, specimen collection sites, and some other information. Thank you.
Great, thanks, Amy. I'm Deanne Baker, of course, to say again, Manager for Primary Healthcare with 7th Street Health Access Center. As well, I am a co-lead for the test site here in Brandon at the town center location. So just as Amy said, would like to talk a little bit about the test sites. So first of all, Prairie Mountain Health would like to thank everyone for your patience and understanding for the wait times experienced over the last week at our COVID-19 specimen collection sites. On August 11th, 2020, Prairie Mountain Health opened a temporary second COVID-19 specimen collection site at the Keystone Center parking lot. The location is in addition to the site located at the Town Center Parkade. Both of the locations are drive-through. The Keystone Center site was added based on recent increased demand for COVID-19 screening in Brandon and southwestern Manitoba. Individuals who have symptoms such as cough, fever, vomiting, or diarrhea for greater than 24 hours, shortness of breath or trouble breathing, loss of taste or smell, headache, runny nose, muscle aches, fatigue, skin rash for unknown reason, nausea or loss of appetite and or conjunctivitis, otherwise known as eye infection, should attend a site for screening. You can call or visit HealthLinks InfoSante for a full list of symptoms to watch for or to do the online screening tool. Public health or an employer occupational health may direct you to come for screening or testing even though you may not have symptoms. However, ideally you should have symptoms present when you are screened and tested. The result you receive from being screened and tested is only a reflection of whether you were positive for the virus on the day you were tested. What this means is that, for example, if you had no symptoms and were tested on a Tuesday and you got your results back on Friday that you were negative for COVID-19, you were only negative on that Tuesday you were tested. If you then develop symptoms on Saturday and Sunday, you should be screened and tested again, as you may have contracted the virus or had symptoms develop since the Tuesday. If you do need to come to one of our test sites, here are a few things to remember and to know. Please be prepared to wait. We are working to reduce the wait times, but there may still be a period of time that you have to wait. We do not, unfortunately, have washrooms available at the collection sites for you to use. When you do come, please bring your Manitoba Health Card, and if you do not have a Manitoba Health Card, please bring with you a recognized piece of identification, such as a driver's license. If you do arrive earlier than the sites are open, please initiate a line up on Princess. Do not pull into the Town Center Parkade. We'll direct you in when we are open. Or if you're at the Keystone site, to just come into the southeast parking lot at the Keystone Center. Someone will direct you when you get closer to the front of the line on where to go, and there'll be signage to follow. You will then be met by a screener who will ask to see your health card. They'll gather your address and phone number, and they'll ask you a series of questions. This information allows us to get the forms done that are required for the test. You will then be met by a specimen collector, and they too will ask you a few more questions. They'll confirm your name and birth date, and they'll explain to you what the procedure involves. They'll also provide you with information on how to monitor your temperature, what it means to self-isolate, and how to get your results either by calling the number on the form provided or visiting the online portal. It may take several days to get your test results, so please be prepared to wait for at least 4 days or up to 7 days to get your test result. Please remember you do need to remain self-isolated while you wait for your result. This means that you should not be at work, out in businesses, getting groceries, or visiting with people. It means you should be at home, ideally with your own bedroom to sleep in and your own washroom to use. You should not be eating with or sharing a kitchen space for food preparation with others. The Brandon specimen collection sites do adjust their hours based on volumes of clients attending. Since opening the Keystone site, we have adjusted the hours, but may increase them again as required. So the current hours of operation are, for the Brandon Town Center site, we're open Monday to Thursday, 8:45 to 6 p.m., Friday and Saturday, 8:45 to 3:15 p.m., and Sundays, 8:45 to 12:30. For the Keystone parking lot, which is currently in the east parking lot but will be moving to the south parking lot as of August 17th, the hours at the Keystone Center parking lot are Monday to Saturday, 8:45 to 3:15, not open on Sunday. And should inclement weather arise, they may have to close that Keystone site and direct clients to the town center. So just in closing, again, we thank all of the citizens of Brandon and surrounding Western Manitoba for your diligence in staying home when you are sick, and for social distancing, performing frequent hand hygiene, covering your cough as required, and being respectful of your fellow citizens' space. Together, we can work to flatten the curve again. Thank you.
Well, thank you very much to both of our guests. I'm going to have a little bit more to say about that, but as our viewers can see, we've just been provided with some very thorough and very important information that our community really needs right now. So we're hoping that everyone is able to tune in at some point. Tell your friends to get on YouTube and find this particular broadcast. The information provided by Dr. Frakoda and Deanne Baker covers a lot of the things that we all need to know. There's important information, also some, in my view, comforting and encouraging information about how we can all battle this response. I'm going to have a little bit of announcement to make at the end of this broadcast, but prior to that, we're coming back to Mr. Brian Kays, our emergency manager, who's going to cover off some important information as well.
Well, thank you, Your Worship. COVID-19, the nasty little so-and-so, is still with us. So a reminder to everyone, in Brandon, we continue to follow Shared Health's recommended guidelines. We are in lockstep with the provincial public health recommendations. So the charmed life we had lived in Brandon came to a screeching halt a few days ago with a cluster of cases of COVID-19. Shared Health's response was consistent with other clusters they have managed in that they continued the contact tracing, identifying people with potential exposure, interviewing them, and having them self-isolate as was required. The cluster reminds us that COVID-19 remains in our community. And as I've said before, the key to managing COVID-19 is to be consistent and unrelenting in how you protect yourself and your family. We all have to work on this, and we have to do it together. This is like many other emergency responses. Everyone has a role to play. We rely on public health to provide information. We rely on business to have safe working places. We rely on the city to provide its services. And we rely on citizens to look after their families. Everyone in the community has to do their part, and everyone must take part in this. People are now focused on wearing masks, and that is a perfectly good decision. But masks are just one more tool to use to manage this outbreak. Wearing masks does not replace any of the other measures. The City of Brandon encourages everyone to wear masks or be prepared to put on a mask when you are unable to maintain 2 meters of separation from others. This is situations like shopping in a busy store Before you go into the store, sanitize your hands and then put on a mask. Always be sure your hands are clean when you handle a mask. You can also wear a mask when you are just out and about in the public or riding a city bus, or generally any time you feel you're being crowded. Another time to wear a mask is when you are in close contact with vulnerable people. This may be someone with existing health issues, or you may be visiting an elderly relative. Wash your hands, put on a mask, keep 2 meters away, sanitize surfaces. You know the drill. Remember, this COVID-19 response that we have is all precautions all the time. The measures you take at work need to be carried out into the community. If you're going to practice physical distancing at work, hand washing at work, wearing masks when needed at work, sanitizing surfaces at work, you need to also practice this when you are away from work. You need to practice this when you are home. All precautions all the time. And those precautions are frequently wash and dry your hands. Keep your hands to yourself. Don't touch things. Do not touch your face or anyone else's face. Cover your cough or sneeze. Be kind and watch out for others. If you are even mildly ill, stay indoors and keep to yourself. If you meet with people, do it outdoors and stay outdoors. You are allowed groups of up to 100 people if they can maintain a distance of 2 meters from one another. If you're not sure, clean your hands and put on a mask. If you meet with people indoors, meet in groups of less than 50 as long as they can social distance from one another. If you're not sure, wear a mask. Use physical distancing and stay 2 meters apart. Continue to disinfect everything you touch and do not share personal things with other people. Keep your cell phone, your smartphone, to yourself. Wear a mask when you cannot be certain that you can maintain 2 meters of separation from others or when you are with vulnerable people. If you're returning from travel outside of Canada, you must quarantine for 14 days. This is a requirement of the federal government. If you're coming to Manitoba from points in Canada east of Terrace Bay, use the provincial self-isolation guidelines, which also require 14 days of isolation. Protect your community by using reliable sources of information. This means manitoba.ca/COVID-19. Finally, do not call 911 unless it is an emergency. Please, work with us, do your part, and we will do ours. Thank you, Your Worship.
Thank you very much, Brian. And as everyone should be aware by now, the City of Brandon, the municipality, is certainly not the health authority. We do not maintain health professionals on our staff. And from the very beginning of this pandemic, we have relied on the expertise that's provided by Manitoba Health, Manitoba Public Health, Prairie Mountain Health. These are the professionals who are trained and experienced in leading a health emergency, and that's precisely what we've been in. And so you could see that the city has taken its position to try and be a conduit and provide as an advocate and an information source so that people have access to the most credible, experienced information that is available. And today was certainly a highlight of that, and we had just tremendous information provided in this broadcast. But there's been much that's been said about masks lately in our community with this recent uptick. And we've heard from Dr. Fukuda and in the Dr. Rusin broadcast that they are recommending the use of masks when physical distancing is difficult, not to take the place of all of the other procedures and protocols that we've all had drummed into our heads over the last many months. It is not appropriate, nor is it expedient for City Council to jump the queue and begin usurping the very professional and experienced expertise who are leading this pandemic response for all Manitobans. However, as with every other element of the fight against this virus, people are not helpless And in fact, the solution does lie in the hands of each and every one of us. It is more important than ever, more imperative than ever, that we refocus on all of these fundamentals. In public, the hand sanitizing, the physical distancing, and where appropriate to wear a mask when physical distancing is difficult, especially right now in our city, in our region. As a result, I'm pleased to announce that as we speak, we are just finalizing details of a very positive community campaign where we will be partnering with Maple Leaf Foods here of Brandon, as we know, a very major entity, a very major employer in our community, and they have stepped up and are partnering, and they are arranging to donate a significant quantity of masks for the use, free of charge, to residents of Brandon and area. Details are just being put together as we speak. I'm sure by the end of the day that will all become available. Tremendous community spirit and can-do attitude that we know exists, and Brandon and Westman will once again shine through, and we will all rally together to do our own individual part to combat this virus and keep our community safe and our families safe and sound. So thank you once again to Dr. Amy Fracoda and to Deanne Baker of Prairie Mountain Health for coming and sharing this very important information. And we're not able often enough, I believe, to continue to thank all of these frontline people. So please, to Dr. Fracoda and to Deanne, back to your teams. Please accept the gratitude of our entire community as this battle wages on. We're all in this together. Brian and I will be back on Monday, August 17th for another broadcast to keep you updated. Be kind to each other. Stay safe. Thank you very much.